I have had 2 meetings with parliamentary committees. All those meetings have been ministers and East African trade ministers, and meetings with the World Health Organization globally, and the team led by Dr. Amoth went into those meetings in a virtual way. We have been holding cabinet meetings, and cabinet meetings have been virtual going forward, and all committees of the cabinet have also been virtual. So I think there is no gainsaying that it has changed. COVID has changed the way that we do things. But in a manner of speaking, it is also a good thing, because what it means is that going forward, there will be benefits that come out of this behavioral change. The quantity of travel, for example, is going to be significantly reduced, because we know that we don't have to travel to have meetings. We have been meetings even with the Council of Governors, and those meetings have been virtual. So I just want to emphasize that issue of it has changed the way we live. As a result of the hygiene measures that people are taking. But coming back to the global disease burden, I think it is established here that as at the 30th of April, a total of 3 million cases globally have 3 million positive cases have been recorded globally, and it is not stopping. It is going higher and higher and higher. Out of that, to date, 760 have passed on. And that's a large number of people when you think about it. 200,000 people, 217,000 people are a lot of people. And by the time we finish this discussion, there will probably be over 220,000 people who will be dead. That, when you look at those figures, the figure of 3 million, the 217, then you can see that the case for it is towards those people who have died, about 10% of the ones who have gotten the disease. In Africa, we have now recorded 24,713 cases. Now, let me explain that this must not be seen as necessarily, Africa being better off than the other. But we were also lucky because what to do, because the other countries had for us. And I think that has helped a little, but that terribly, because and when you look at in Kenya, when you come to Kenya, today we tested samples in the last 24 hours, about 1,404 samples. Out of those numbers, we have got 8 females and 7 male, and they range between 2 and 79 years of age. And since confirmation, you can see the numbers there, the 3,684 people. We have discharged 2,854. And we are monitoring at least 830 people. And those numbers will go up because we have increased our test. We have increased the what we call targeted mass testing. For instance, today we have got a big team in town that is going to go some of the going to mention. Moving on, we have got next slide. Moving on, we have got the graph here illustrates, and this is an important graph. This illustrates the number of cases, as you can see, in comparison terms. When you compare what is going on here, you can see this line up here of over 200,000 cases. This is in Italy. You know, it's 203,000 cases. And when you come lower down, you can see Ghana at 1,671 cases. The Tanzanian figure, as at I think or 4 days ago, stood at about 480 cases. And here is Kenya. Kenya, that figure has also changed. It is not 396 since we did the graph. It is now at 411. 411. Kenya has 411 cases. Now, when you look at the analysis of our cases, where are these cases and where are they coming from? Then you can see we have got 411 confirmed cases. We have got 150 people who have recovered. In other words, 36.5 of the people who have gotten the disease, just about over 1/3 of the people who have gotten the disease have recovered. And remember, the global fatality rate is 7%. And further out, you can see, and what you have here is that the white spaces that you see there represent areas that have recorded zero positive cases all the way from, and you can see on the north, in the north you can see the issue of Mandera. Mandera is out there at 8, Wajir is down here at 8 at 2 cases. Now, the danger with this area here is Somalia, which is here, because Somalia to date has recorded over 528 cases already. And that also is a node figure. So we don't know. In other words, the area around Somalia is a worrying case, and that's why we have isolated Mandela, just to save them from that. And we have isolated from the borders here so that we can contain the situation in Mandera. You can see that Wajir is following now with 2. We hope that because of the closure of the border between Mandera and Wajir, we now need to close Wajir and Somalia so that we don't spread the disease out there. And in Kenya, what you are seeing here is, if you look at the red represents figures of over 150. And those are essentially Nairobi, out here, and Mombasa. And when you look at the coastal region, you can see Kwale down here with 2, Kilifi with 8, and Mombasa at 124. So Mombasa, again, in today's figures, for example, today we had 15, and out of the 15 that we got today, 11 from Mombasa. So Mombasa is beginning to be a worrying situation, and further measures, we have to take further measures to contain Mombasa. Now, again, this is just the trend of what has been happening in the country, and let me explain a little bit. 12th of March is when we recorded our cases, and then they started climbing up. As you can see up here, they started climbing up, and then that is when we started the mandatory quarantine at that date. So we went down a little bit on the testing. You remember we had issues of testing kits and so on and so forth. Then we declared the curfew here, and immediately after the curfew, you can see the figures begin to go down. But after that, then we started now testing the people in quarantine at that time. And you can see what happened when we started testing the people. Now, and that just if we do not have the mandatory quarantine, then you can climb up to the 10,000 figures. And you can see this. If this had continued going up, then you can see what the results would have been. And here you can see now, at this figure, we have got, is going up a little bit. We recorded 12, now we have gone up to 15, but the 15 is also justified by the higher number of testing of the samples that we took. Because if you remember, yesterday we had 777, and out of which we had 12. Now we had 1,400, over 1,400, and we have 15. So you can see the increased testing producing those people. Now, let me just disabuse here some of the cases that have been, and this is why this is important. 0 to 4, people think that when you are young, you can't get the disease. But you can see that we have cases of 0 to 4, 0 to 14. In fact, we have 2. You know, that's the case we have. When you look at the age groups, just in terms of the disease, you can see the 15 to 29s, and these are the young people. You can see that they have got, they are getting the disease. The 15 to 29 group, and it's very mobile. These are the people in nightclubs and so on and so forth, in pubs, in the evenings, and you can see now why curfew is an important part of the measures that we have taken. Again, a very active group between 30 and 59. Now, when you look at the gender, if you look at the gender distribution, you have got a 44%, or 181 of them being female, and the blue, which is the bigger group, 230 being male at about 56% of the cases. Now, this is a very important presentation as well, because this was the reverse. When we began these presentations, this was the reverse, that the local cases were much less than the imported cases. But as you can see, the imported cases now have, the local cases have over imported cases. Now, when we say that people should keep social distancing, and when we say that one person can transmit to very many people, this is the illustration that it has. This is a real case. What we are talking about here, what we have illustrated here, is a real case. And I've got 2 examples. One example is the first case in Kawangware. When the first case came into Kawangware, at this point, that was case number 189. From case number 189, the immediate contacts that resulted from case number 189 is what we call case number 243, case number 244, and you can see these ones are together, which means they must have been somewhere together. They were collected together, and they were put in isolation, in quarantine together, and then tested. So you can see that 243, 244, 245. And then, at the same time, somebody took 258, 269, 270. All these cases are a direct transmission of case number 189. And I think this is a very important thing to see. When we talk about the fact that one individual is crucial and one person, this is all in Kawangware now, and this is real. We are talking about real numbers. Now, then comes now the secondary cases. From case number 258, you can see what has happened. Case number 370, case number 371, because these ones came directly from here. Now, you might ask, why is it that case number 258 has got all these numbers and case number 243 does not have? It depends on how much activity this person had, at what time did we discover them, at what time did we isolate them, so that they do not go spreading it. But at the same time, there might be still ongoing people in quarantine who have not been tested on that case. And probably at some point, figures growing from that one. This is the case in Malindi, the famous case in Malindi, case number 14. All right? From case number 14, case number 15, case number 23. Now, this has gone on to case number 141, the contacts of the contacts, and now we have gone even further. from the Malindi, from one Malindi case. And we have no what we are going to do. This is just an illustration. One individual can have in terms of the COVID-19 spread. And then the hotspots around the country and areas that we are currently working in. As we speak, there is a team, our team of health experts, and sampling is going on in Kawangware, where we now have 13 people. 13 people they have tested positive. Now, these 13 people are with us. It's important for us to say that these people are not in the streets. All these people you are seeing here are people in isolation centers. And there lies a very important exercise of contact tracing. Because unless we can contact trace these people, it means that these 13 people would now be spreading it throughout Kawangware, and it goes like fire. So the illustration here, again, in we have 6 cases. Kamukunji, 11 cases in Isli. You know how densely populated Isli is. So when you hear that there are 11 cases, we have now got a lot of those people also in quarantine because of those 11 cases who are now positive. Again, some other hotspots, South Sea. Then you can look at Kebra. Kebra, we have been very, very careful to isolate these people as possible because, again, unless you contain them, and there's a team also that is also carrying out surveillance in Kebra so that those figures don't keep on growing. Mombasa, you can see, Mvita is the main area. This is where we had an 87-year-old herbalist who died in that Mvita area. All these cases actually can almost be tracked back to the same source. Again, Mombasa, KPA has been a big challenge. We believe that we have now kind of managed to collect and gather the people in KPA very carefully, but we have a bit of testing within KPA and also quite of people. But as you can see, the figures in Vita are really growing, you know, and it is imperative that persons living in what figures tell you is that they are a call for action. If you live in Kawangware, you know now that the center in Kawangware and the disease is spreading in Kawangware. You know that if you live there. If you live in that the next person you are talking to could very well be COVID-19 positive. Therefore, you need to take action. You need to keep your distances. You need to keep washing your hands if you come in contact with anybody. If you go to the market, you need to make sure that you are not touching stuff that has been touched by other people. Keep on washing your hands. Anybody with a shop in Mvita, anybody who has got an Italy or whatever it is, you must follow the rules that we are making in order to keep Mvita safe. Again, on the issue of the people who have died, this is an interesting one, and the figures that we are finding point at females recovering a lot faster and in bigger numbers than the male population. As you can see, 46% of the people who are positive are female. But when it comes to the death figures, only 19% of the people who have passed on, out of the 21, is it 21? Out of the 21 persons, because today we have 4. We have increased the death by 4 people. And out of those, 19% are female and 81% are male. It is, we believe that the reason why there is that disparity is because of preconditions that exist more in male than female, you know, high blood pressure, heart disease, etc., etc., etc. Again, we had established that the imported cases, out of the deaths that we have, local imported cases were only 2. Now it is local transmission that is killing our people. As far as the age groups are concerned, again, take note of 2 things. Number 1 is that, as I said, we have had a death in that area. But I want you to take note of between 15 and 30 years old, nobody has passed on. Between 15 and 30 years old. What that tells you is because you saw the figures of the infected persons, and you can see that between 15 and 30, what it tells you is that this group is the one that can spread the disease. And this is why we are telling Nairobi people, stay in Nairobi. Please don't take this disease back to the older people up country. This is a perfect illustration of that circumstance and the reasoning behind. We have always told you that we are taking decisions based on empirical evidence and data. This illustrates that and explains it. When you go further down, you can see that between 30 and 59 and above 60 is the same figure. And if you break this down a little bit more, you'll probably find that this number of the 10 would lean more towards the above 50s than you would in the lower 30s. So that whole graph is to ask kindly and to urge people who are between 15 and 30 years old to note that you are carrying, you are passing it on and killing other people. Instead of contacting older people, distance yourself from them. At this moment, call your mother. If you're in Nairobi, don't go to see your mom, call your mom. Talk to her for the time being. A time will come when you can travel. Again, we have been talking about testing capacity, and this is a question that has been raised. These are the areas that have been carrying out the tests, and you can see as at now, we have had 21,702 samples. And within the 15 labs that we have, we are continuing to expand testing capacity in other areas. I believe that as we expand, then even you can see here, for instance, where is Wajir? Wajir is, yeah, you can see, for example, we have opened out Wajir, for testing. We are hoping that in the next couple of days, we are going also to open up Mandera for testing. So, and we will continue to expand our testing capacity. Our ongoing activities include expanded testing. For example, the presidents of both Uganda and Kenya have told us that drivers must be tested. So what the protocol we have established for truck drivers here is that we will test them in Mombasa. So before a truck driver leaves Mombasa, you must make sure that you have done your tests. You can do your test 48 hours before you leave. But what we are telling them now, we will not allow anybody, any truck driver, going to cross the border. Before you leave, before you get into a vehicle to depart, please make sure that you have been tested. Because what it means is that if you don't do that, then the Busia border, there are so many people there at the moment. You are just going to increase the problem. And for that reason, therefore, our health officials are under instruction to ensure, and we are asking the enforcement agencies to ensure that drivers leaving their destination to go and have all been tested. It is also, as you know, to contain the disease because of the stopping of the areas that long distance drivers stop in so many places. So we are saying that must be done. Again, we have given the restaurants and eateries protocol, and we will not hesitate. Let me just say this: we will not hesitate to close the restaurants that are not observing what we are saying. And it will be very expensive for them because you have already tested your people, you have already spent money, and then you get closed down. So please, as we move on, let's make sure that we keep that protocol. Again, we are continuing targeting the health workers. Any health worker is an ongoing process at all times that health workers must be tested so that, again, they do not affect people when they are being treated, when they are treating them. As I said earlier, additional testing capacity is going into Busia, Machakos, Kitale, and also Malindi. And as I mentioned earlier, an additional one there is Mandera. We are also scaling up the training of health workers. Again, it's a continuous exercise. We have particularly targeted health workers who are going to be using ventilators because there is specialized training for people with who are going to use ventilators. Continuing of mass productions of PPE. Today we are here with Airtel, people from Airtel, who have come to make a presentation to us of some 6,600 locally made PPEs. So when we promised that we are going to increase the supply of PPEs, it is already happening. And within the next 2 weeks, we do not believe that there is going to be any county that is going to be saying that they do not have PPEs. You must remember, however, continuous exercise, because most PPEs are used only once and then left out and then thrown off or incinerated. Travel restrictions, as we have said, are still on. There is nothing that has stopped. All the measures that we have taken are there, and we still urge the public to be aware of the matter of distancing and all the other hygiene measures that we have taken. So that's the end of the presentation today. I just wanted to illustrate some of the things that we have been talking about, and it is important for us to I think when it is done this way, graphic presentations sometimes have a bigger impact in people, and they understand things better when they are illustrated as they have been. Thank you very much. It's okay.
Thank you. I am Mark Lamako from KTN News. I'm asking this question on behalf of healthcare workers. Many of them have been forced to stay away from home. Lamako from KTN News. I'm asking this question on behalf of healthcare workers. Many of them have been forced to stay away from home and seek accommodation away from home during this crisis. The question is, were there funds allocated for their boarding fees, and how much was it?
My name is Furious from KBC. I'm a directive to have the truck drivers tested, and that's also the restaurant workers. Probably can expound on the validity of every test because I understand they will be making many trips, the truck drivers. So what's the validity of every test? And then another question would be on, we are on a new month, and you are explaining about how we have been or these are still not okay for the nation. And so lastly, there was a time the CAS for Health Dr. Rashid talked about the home care program, especially for people who are in quarantine. It's a bit expensive for people to stay in quarantine and pay what they're supposed to pay. Probably when are you thinking about launching this home care program where people can quarantine at their homes?
Thank you very much. Let me first of all take those two, then I can take another two. First of all,
for example, when you go to Kenyatta, KU, we have actually furnished some apartments where they are now staying, and in circumstances where where workers are supposed to stay inside the hospital, then it is our job to support that financially. Purity, on the issue of the drivers, what we are saying is that every 14 days, you'll be retested. Okay, every 14 days you are retested, because when you travel to Uganda, whatever, take 14 days to come back, every 14 days you will be required to be retested. On the issue of the home care, yes, it is continue to have. And let me emphasize this, because it is so important. The only reason why Kenya has not adopted, a flat home care program is because of our indiscipline. Let's be honest. There is no other reason. In Germany, in Sweden and those countries, they have got basically perfect home care quarantine policies. They will obey the law and they will obey the rules. You have yourself seen, I have just established for you, the culture here is such that home care programs will be introduced very slowly and at a time when we think and know that we are taking this disease seriously. There has been cases where we have done it, where we have adopted home care. For example, as you know, there will be people who will be coming from, some of them will be hospital cases, and we are not going to quarantine them in quarantine facilities. We will ask their doctors to be the supervisors of their home care, of their home care programs and home care quarantine. But as for the general public, we do not still feel confident enough to launch that program. You also asked about the testing. Let me also say this, that government hospitals are now offering testing at a much more reduced rate. I know people are talking about 10,000, 15,000 for testing. Government hospitals are charging between 2,000 and 4,000 shillings. And we reduce those prices so that people who need testing can actually get it. Those are subsidized testing rates. Right. Yeah, sorry. The modeling.
Maybe this is the highest amount in terms of fatalities. Is it something to worry about? Today as we start a new month. Second question would be, are there standards for these pregnancy facilities, like standards? Because we just had a report of a woman with a baby, an infant, who are subjected to very inhuman conditions. So Kenyans are asking, are there supposed to be at least moderate standards in terms of quarantine facilities? Then my last question would be regarding, of course, you're not the immediate accounting officer in the ministry, but again, prioritization in terms of budget and expenditure.
Actually, yesterday on your Facebook account, you said that there was actually a cohort let me just get it verbatim, a cohort that believes in exploitation. So my question
Can you read the context? Because,
this is what you said.
if you see the population is dense,
This is what you said.
you can mean the population is foolish or the population is high.
So we said, and so I'm here to let you know that amongst us is a cohort that believes in exploitation and that thinks that by spreading lies, innuendos, and
Then it becomes very clear that I'm talking about those people out there who are spreading malicious rumors and what have you. Now let me respond this way. You have seen for yourself, even in the media, in social media. Somebody even saying that all the advertising that is being done in this ministry is being done by my company. You know, you have seen that yourself, and I would like to declare here and now, I have never done any business, not only with this ministry, any ministry in government. It is my policy, at least when I was running private business, because I have also got to distance myself from the company. But even any company that I've been involved in does not do business with the government. And this is clear. So when I say that there are those kind of people out there spreading malicious rumors, it is true. It is absolutely true. And not that it is affecting me, because, you know, I've got my eyes on the ball. I know what I'm doing. And as for the issue of the budgetary expenditure here, again, it is very easy to put things out of context and make it look like there is theft, you know, going on in the ministry. And in the same Facebook post that I did, you should also have read that I said that anybody who is culpable in terms of any sort of 1 shilling expenditure in the COVID-19 funds, if indeed there is one, will not be spared. And I meant it, and I mean it even now. But I would like to get to the point where that is the case, because I have some of the details that are being explained away as theft are clear expenditures. You know, for example, I'll give you one example. When you say, for instance, that there is 42 million shillings spent on ambulances, I would like you to tell me, you know, Seth, I don't know, maybe you can tell us how much you would pay for an ambulance one day, you know, for 1 day, an ambulance 1 day, taking you from wherever you come from, you know, or from Nyeri, where I come from, to bring you to the same day, how much you'd pay for an ambulance like that. What we are talking about here, for example, the 42 million shillings, 5-point-something million out of that is tax, first and foremost, that's VAT. Then you take the other money, you take 15 COVID-19 ambulances, all right? You take 15 ambulances, you put in those ambulances the health workers who are working in those ambulances, you put the PPEs those people are using in those ambulances, you give them 2 shifts of people, because you have got 24 hours. You are in with that ambulance hours. Okay? There are 15 ambulances. You have got them for 12 weeks. That is 3 months. You know, spread that over 3 months and do the maths. And tell me where you can get an ambulance like that in this country to manage the kind of things that we are managing. So do the maths. So what I'm saying is this. It is always good to put things in perspective, so that when you put a figure, it is a figure, and to ask yourself, is this a figure for a month? Is this a figure for 6 months? You know, how much time are we talking about? If you have got people who are working over a period of 3 months, 4 months, and they are locked up somewhere taking course, they have to eat, they have to be fed, they have to take tea, they have to be there. What are they supposed to do? Are they not supposed to eat at some point? So let's put things in perspective. Not to say that we are not investigating everything. Here, every shilling is investigated for and accounted for. So I just want to say that not to defend in a case, but to be clear that the principle that we have adopted is that there will be no shilling that is going to be anything else other than the COVID issues that we have raised. So I want to ask Dr. Amos to come and respond to the other issues.
Thank you, Waziri. I think I'll start by responding to the question from Purity, regarding the numbers and what we are likely to see going forward in the month of May. One, this will be determined by the targeted mass testing that is taking place now in Kawangware, Isili, in Mombasa. But looking at this graph, and that is why I told him to bring it back. Basically here we are dealing with established local transmission. if we continue with the measures that we have taken before, the hand washing, the use of sanitizers, wearing our face masks, and physical and social distancing, and of course we maintain the restriction of movement, then it is likely that these figures will just overrun what the curve is showing. However, if there's any breach in terms of what if we go outside there, then you can be able to have an upswing in terms of the figures. Regarding the quarantine sites, we have standards and guidelines which ensure that we have psychosocial support of those people who are there. We have standards regarding safety if you are in a quarantine site, and we also have standards in terms of hygiene, so that wherever you are staying, the rooms are clean, the linen is changed as frequently as is probably possible, to ensure not only the safety of the people who take sites, but of course the quarantinees in those particular sites. So I think based on the results of the mass testing, we'll be able to give you our figures going forward. And modeling is not a constant parameter, it keeps on changing, taking into consideration new data. The result of your modeling will be based on the inputs of the data you key in. It will be able to give you. And we cannot say that, for example, the figures that we had for April may obtain in the month of May. So with this new information, we'll be able to give you further information going forward after analysis. Thank you.
Thank you very much.
Asante Waziri.
Asante.
Namaste.
Na mtazamaji, imekuwa ni taarifa ya moja kwa moja kutoka jumba la afya hapa jijini Nairobi, ambapo waziri wa afya Mutahi Kagwe amekuwa akihutubia wananchi akisema kwamba huenda mipaka ya Mandera na Wajir ikafungwa kutokana na msambao wa virusi vya corona. Vile vile mtazamaji, ameweza kuripoti visa 15 zaidi vya corona, huku visa 11 vikiwa vya kutoka kaunti ya Mombasa. Mtazamaji, kumbuka kufikia sasa Afrika peke yake imeweza kuripoti idadi ya watu 24,713 ambao wameweza kuambukizwa virusi hivi. Duniani mtazamaji, tunao watu 217,000 ambao vile vile wameweza kuaga dunia. Kufikia sasa Kenya imeweza kuripoti visa 411. Karibu kwenye taarifa za Shina la Upeo mtazamaji. Tumekuandalia mengi tu. Hapo awali tumemuona waziri wa afya akizungumza moja kwa moja kutoka jumba la afya. Lakini kwa sasa mtazamaji, karibu kwenye Shina la Upeo. Jina langu ni Andrin Kilemi na ananisaidia kwa lugha ya ishara ni Ana Wairimo. Taifa leo limejumuika na ulimwengu kuadhimisha siku kuu za leba, japokuwa kwa utofauti mkubwa, kwani kinyume na awali ambapo Wakenya walikongamana katika bustani ya Uhuru, leo basi sherehe zimefanyika katika ikulu ya rais hapa jijini Nairobi, ambapo Rais Kenyatta, waziri wa leba Simon Chelugui sawa na katibu mkuu wa chama cha wafanyakazi nchini Francis Atwoli wametoa wito kwa Wakenya kujikinga wakati huu wa virusi vya corona.
Tusitumie hii vita ya corona kama ni wakati wetu wa kupiga siasa duni. Unasikia huko mwingine akisema pesa ya corona haitumiwi vizuri, ingetakiwa itumiwe namna hii. Jameni, tusicheze na maisha ya Wakenya. Pesa yote ambaye imetumika kupambana na hii jangwa, wakati ukifika, it shall be audited in broad daylight. Kila shilingi, kila dururu ambaye imetumika, Wakenya waweze kujua hii pesa ilitumika kwa njia gani na kusaidia nani. We shall make it public. Hakuna kitu ambaye itafichwa. Lakini hii sio wakati ya kugombanisha. Hii ni wakati ya kuokoa maisha. Jameni, tafadhali viongozi, if you have mercy on your people, this is the time for you to be supportive of the efforts that we are all undertaking to ensure that we defeat this virus. Niseme pia ya kwamba Lazima tuangalie mbele. Tujue ya kwamba corona haitakuwa na sisi maisha. Bado tunataka soko zetu zirudi. Jameni, nilicheka juzi nikaona wengine wako hapo akisema Uhuru afanya makosa, atuma maua kwa wazungu. Jameni, unajua hayo maua ambaye tumetuma, corona itaisha. Hayo maua yaandika wafanyikazi, maelfu na maelfu na maelfu ya Wakenya.
Na mtazamaji, tuangazie mengine ambapo polisi 8 jana jioni walihofiwa kufa maji baada walipokuwa wanaelekea katika kituo cha polisi cha Astu baada ya mvua kubwa kunyesha na kuwasomba walipokuwa wakisukuma gari hilo kutoka mto Kagiri. Kamishna wa polisi kutoka kaunti ndogo ya Baringo Kaskazini Robinson Thiwa amesema kuwa mwili wa polisi mmoja ulipatikana na shughuli ya kusaka miili mingine inaendelea. Mtazamaji, waziri wa masuala ya ndani Daktari Fred Matiang'i pamoja na inspekta mkuu wa polisi Hilary Mutyambai wamewatembelea wanawake watatu ambao wamekuwa wakijitolea kuwasaidia polisi wakati wa njaa kwa kuwapa chakula katika kizuizi kilichoko katika barabara kuu ya Kangundo.
And I appreciate so much from the bottom of my heart on the behalf of the National Police Service for the good work which we have witnessed. The ladies, the 3 ladies who have been serving the officers on duty for almost a week or so. 3 weeks. This touches us as officers because one thing you know that police, we are in the front line in terms of managing this threat of the COVID-19. We are working 24 hours.
Ofisa wa polisi kwa sababu hao ni wale ambao tulipata the first contact katika roadblock ambao tuliwapata, walikuwa wameketi pale na walikuwa wanafanya kazi na walikuwa wanakaa wana huzuni, walikuwa wanakaa ni kama hawajakula chochote. So wakati ya kwanza, wakati tumewaletea soda wakasema ni sawa, umetupatia soda lakini tuko na njaa. So kwa sababu hiyo tukasema acha tuende tukapike. Na wakati tumeanza kupika tu pole tunasema acha tupike leo, tupike kesho, wakaanza kusema mnatufanyia mzuri, tukaendelea na kufanya hiyo kazi bila shida yote. Sababu ilikuwa imetoka kwa moyo wetu kuwa feed. Sababu kama mimi naishi pale, mimi ni neighbor na nikikula nakumbuka kuna watu ambao wameshinda pale kwa jua hawajakula siku nzima.
Wakati tumekaa na CS ametusupport, ametu appreciate sana. Amefurahi na wakubwa wote wale wamekuja na wao wamefurahi. So tukaanza hiyo kazi, tukaanza kutoa pesa kutoka kwa mfuko, tunawapikia chakula kwa nyumba ya wakili. Wiki 2 zilizopita dada yetu Rebecca wa Bekis akaungana nasi akasema wacheni tusaidiane ili tupate kufeed hawa askari na watu wa health.
Waziri wa Afya Mutahi Kagwe na katibu mkuu katika wizara hiyo Susan Mwachache wanatarajiwa kufika mbele ya kamati ya afya bungeni siku ya Jumatatu kuwasilisha ripoti kuhusu bajeti na matumizi ya pesa zilizotengwa kukabiliana na janga la virusi vya corona. Hii ni kulingana na mkuu wa kamati hiyo Sabina Chege ambaye leo alitembelea kituo cha kuwatenga watu wenye virusi hivyo cha Mbagathi. Kamati hiyo pia imetoa wito kwa serikali ya kimataifa kuweka mikakati ya kuwafadhili wanaofungwa karantini.
We had asked the ministry to actually give us a tabulation on what has been used, or what is in their budget, what they are budgeting for. We received that tabulation from World Bank, which was quite shocking for all of us. But we have agreed with the minister and the PS that on Monday they will come before the committee and explain, because they said there was some error somewhere. So we are waiting to hear, and I know Kenyans are waiting. I'll only ask for patience. Let us not judge before we actually know, but any person who will misuse what has been put aside, whether by donors or by government, for this good cause. I think they will have to carry their own cross.
Kwingineko mtazamaji, wanaharakati kwenye kaunti ya Trans Nzoia wametilia shaka utaarifu wa kaunti hiyo katika kukabiliana na virusi vya corona. Wanaharakati hao wakidai kwamba fedha zilizotengwa kushughulikia janga hilo bado hazijulikani zilipo. Bonfas Barasa anatuarifu zaidi.
Kila kaunti ikiwa mbioni kuweka mikakati ya kibinafsi inayonuiwa kufanikisha udhibiti wa msambao wa janga la corona. Kwenye kaunti ya Trans Nzoia, wanaharakati wameibua masuala chungu zima kuhusu makadirio ya bajeti ya dharura iliyotengwa kwa ajili ya utaarifu wa kushughulikia janga la corona.
We have approved a budget of fighting COVID to the tune of 150 million, which is being forwarded to the Assembly for approval, so that the way the county commissioner said, we are preparing for the worst case scenario, how to make sure that we are able to fight COVID with all the resources available. So we also as a county are also moving in that direction of preparing in case of the worst case scenario.
Kuna PPEs, hatuizo maski ambazo tunaona hapa ni wale wahisani wamejitolea na wakaweka kwa kaunti hii. Tunapoongea hivi leo, County Assembly ya Trans Nzoia watuambie hizi 150 million ambazo wametenga kupambana na virusi vya corona ni nani, ambazo wameakisa nini ambaye imeletwa, kama kuna mask, kama kuna PPEs, kama kuna mitungi ama sanitizers imeweza kununuliwa.
Licha kutengwa kwa fedha hizo, utaarifu wa vituo vya kuwatenga wagonjwa nyanjani walioathirika inasalia kitendawili. Lawrence Mogosu ni mwenyekiti wa kamati ya utekelezaji bungeni.
In case of any attack to our county by the coronavirus, at the moment, I'm sure we may not be prepared as well. So we are also moving with speed to make sure that as an assembly, we do our work to make sure money are put in place, such that those facilities are equipped.
Ni vitanda 7 pekee ambavyo vimeweza kutengwa kufikia hii leo, na vitanda 7 vyenyewe hafiko kule katika hospitali hiyo dispensary ya Kaisakat. Hii Mount Elgon hospital ambayo inasemekana imetumia around 57 million. Tunasikitika kwamba mpaka sasa tunapoongea tunaanza kutilia shaka utumishi wa pesa za umma, hasa wakati huu wa janga la corona.
Ni hali ambayo inaendelea kuibua minong'ono miongoni mwa wahudumu wa afya, wakilalamikia kupuziliwa mbali kwa matakwa yao wanapojizatiti kuwa mstari wa mbele kufanikisha vita dhidi ya janga la corona. Willy Sifuna ni katibu wa muungano wa wauguzi tawi la Trans Nzoia.
So any expenditure without caring about the health workers, to us that's a misuse of the funds. Yes. It is not proper to have road shows when you don't have PPEs. And at the end of the day, we shall be told that a lot and millions of money were spent on road shows when the real people have been exposed.
Haya yakijiri, mwakilishi wadi wa hospital Eric Wafula amemrai gavana wa Trans Nzoia Patrick Kemba pamoja na jopo simamizi la kushughulikia corona angalabu kusambaza vifaa hitajika kwa wananchi ili kuzuia corona.
Mimi ningependa kuomba mheshimiwa gavana na kamati ile inahusika na mambo ya COVID, tafadhali hakikisha kwamba wananchi wamepewa mask, wananchi wamepewa sanitizers, wananchi kama inawezekana vile tunaona mahali zingine wananchi wamepewa chakula, na hata zile pesa zenye tunaona watu wanapewa kule Nairobi, hata sisi tungependa kuomba serikali kupitia kwa rais watu wa Trans Nzoia nao wapewe hizo pesa.
Wale ambao ni maskini sana katika kaunti hii yetu, already tumechukua that data and we've already identified wale mbaya zaidi ya familia 600 wale ambao wako katika slums na hali yao itakuwa mbaya zaidi.
Bonfas Barasa, TV47, gatuzi la Trans Nzoia.
Mtazamaji, kutoka kaunti ya Trans Nzoia, shina la upeo litakuwa linachukua mapumziko mafupi tu. Naona jumbe zinazidi kuingia kwenye mitandao, kwenye Facebook. Namuona Ankate ambaye anasema anatazama, Abel vile anatazama, Nani Wangeshi na Jeru Joani. Mtazamaji, zidi kusalia nasi, tunarejea baada ya mdoso kwa mrefu.
Mount Kenya University takes pride in being an academic giant with some of the best infrastructure, imparting knowledge to the best brains in the country and the region. Our members of faculty are keen to deliver market-driven programs in science and humanities with a keen focus on linkages with relevant organizations. We admit both self-sponsored and government-sponsored students under the Kenya Universities and Colleges Central Placement Service. Join us today and train with the best to become the best. Mount Kenya University, unlocking infinite possibilities.
Hey, Sospitason, tumefutwa wote.
Yawa, pia wewe?
Tumeachiliwa.
Si pia wewe unaweza anzisha biashara yako?
Na hii economy venye iko tough sana.
But not too tough for Mwananchi Credit.
Tutafanya aje?
Si niko na 5 good cars. We can get a quick logbook loan approved within 6 hours.
Nataka kuanzisha salon na spa. Hii haitatosa.
Si tuko na title deed spare. We can still get more money using them. Get a quick approval within 6 hours using your logbook or title deed. Do not get stuck. Call Mwananchi Credit today. Si nilikuambia.
You are a big smart joke.
Mwananchi Credit. Investor in people.
Karibu tena mtazamaji, asante sana kwa kuzidi kufuatilia taarifa hizi. Iwapo ndo mwanzo unajiunga nasi, mie ni Andrin Kilemi, mtangazaji kwa lugha ya ishara ni Anna Wairimu. Bunge la kaunti ya Machakos linatarajiwa kukamilika hapo kesho baada ya kuanza vikao vyake hapo jana. Kati ya wawakilishi wadi 59, 26 walikubaliwa kuhudhuria vikao hivyo, na hatua hii ni kulingana na uamuzi kutoka kwa Wizara ya Afya katika kukabiliana na virusi vya corona. Kulingana na spika wa kaunti hiyo Florence Mwangangi, kuna baadhi ya mambo ambayo hayawezi kuachwa na ambayo yanahitaji kushughulikiwa kwa dharura.
The issue of treatment is a little bit of a challenge because we still don't have medication as such. From what we hear from those who know the medicine side of the profession, all we can do as people in the public arena is to keep safe, follow those directives of washing hands thoroughly, of keeping the social distancing. We're having just one sitting for the time being every week, whereas we're supposed to have 2 sittings, that is morning and evening. But we're having just one for the time being because, again, there's also the issue of emergency law.
Na mtazamaji, tuelekee Vihiga ambapo hofu inazidi kuwakumba wenyeji wa Shamahoho katika kaunti ya Vihiga baada ya uvumi kuenea kuwa huenda aliyekuwa akilengwa na majeneza mawili yaliyopatikana katika makazi ya watu yakiwa yameloa damu na manyoya ya kuku hakufikiwa, na kuna uwezekano wa tukio hilo la kuogofya kurudiwa kijijini humo. Mulindi Keri anaripoti zaidi.
Hili ni soko la Shamahoho na shughuli zinaendelea kama kawaida. Usilolijua ni hofu inawasakama wenyeji hapa baada ya kisa cha majeneza mawili kupatikana zimetupwa nje ya nyumba hizi zikiwa zimeloa damu na manyoya ya kuku. Je, mulengo alikuwa ni nani?
Na pale ambapo waliweka jeneza la Mazinga Umbwe, sijui kama waliweka ama ili fly, I don't care. But waliweka kwa boma la rafiki yangu who is the former chairman of Public Service Commission at Vihiga County Government. Waliweka kwa boma lake, wakiliweka kwa premises zake pale Bumira, thinking that it is my compound. Halafu wakaweka kwa compound ya a hustling businessman hako na some rentals ambazo waliambiwa they are mine. So wale ambao wanasema hii ni vita ambaye mimi nimeenda kupeleka ndugu yangu Isada kwa ushirikina, nataka kuwaambia saizi washindwe katika jina la Yesu.
Sylvester Kibachi Shipira anaeleza kuwa hii si mara ya kwanza kwa visa vya kimazingaumbwa kumlenga, akihisi kuwa visa hivi vinachochewa kisiasa. Wakili wake Alex Masaha hata hivyo anasitiza kuwa wahusika watakabiliwa na mkono mrefu wa sheria pindi tu uchunguzi utakapokamilika.
It is not the first time and I am planning to do more. Wakati nilinunua gari langu la kwanza in 2019, waliseti accident mbaya sana against me. I rolled with the vehicle that rolled 3 times. But I left that vehicle kama sijaumia mahali popote. Na mimi utembea na Biblia kwa gari. And I believe in God. Waliposhindwa hiyo, wakatuma hata nyoka kwa nyumba yangu. Lakini kwa maombi mimi nilichoma hiyo kitu, nikatishiwa utafura mikono, imefura wapi?
Nina hakika wale ambao wamefanya hiki kitendo cha ushirikina, hichi ni kitendo cha jinai kinyume na maadili ya demokrasia, na hawa ni waoga. Na tunawahakikishia kwamba kama hawatashikwa na sheria ya hii dunia, watashikwa na sheria ya Mungu.
Amasaha aidha anakariri kuwa wale wanaoendeleza tuhuma hizi watafunguliwa mashtaka ya kumharibia jina mteja wake.
This is hii kitendo ni it's defamatory, hii ni kashfa, na to the moment we identify these people, we have defamatory laws in this country and also it's a crime. So nina hakika serikali itachukua hatua. The perpetrators once brought to book should also be ready to face legal action for defamation.
Ni kisa ambacho kimewaacha wenyeji hapa Shamahoho wakilaumiana na kukisia tu kuhusu wahusika wakuu. Mulindi Kerry, TV47, Shamahoho kwenye kaunti ya Vihiga.
Asante sana Mulindi Keri. Mtazamaji kutoka Vihiga, tuelekee Narok ambapo katika harakati za kuhakikisha vifaa vya kudhibiti korona nchini vinapatikana kwa wananchi, chuo cha kiufundi cha Narok kimeanza mchakato wa kushona barakoa na magwanda ya wahudumu wa afya. Kwa sasa kituo hicho kina uwezo wa kushona barakoa 3,000 kila siku. Gavana wa kaunti hiyo Samuel Tunai ametangaza kuwa serikali yake itanunua mashine 20 ambazo zitasambazwa kwa vituo vya masomo anuai vya Enkare.
As a county that we are able, we have skills which can manufacture this mask. We don't need to be going to buy it in Nairobi or even China ama hiyo malingine ambayo zote zinafanyika. In our own Narok Technical and Vocational Training Center, we thank God we don't have a single case of coronavirus. Tunashukuru, tunaomba wachungaji wetu waendelee kutuombea. Na hiyo sio kusema ya kwamba haitaingia, mpaka sisi wote tukubali yale maagizo ambayo tunapatiwa. So all our boundaries as we speak are very very dangerous positions ambaye lazima tuone vile tutamanage hizo situations. This committee is working. Nashukuru county commissioner tayari ameconvene meetings ya DCC na watakuwa pamoja na our sub county staff so that they see how our borders vile wanaweza kumanage this situation.
Na mtazamaji, baada ya taarifa hiyo kutoka kaunti ya Narok, shina la upeo basi linatamatika. Asante sana kwa wote ambao wamekuwa kifuatilia taarifa hizi. Namuona Liz Mukami, Peace Kamadhi, Brenda Gaki pamoja na Susan Kadha wanasema wanatazama vile vile. Tunaye Joseph Kang'ethe ambaye pia anasema anatazama kutoka Florida, USA. Mtazamaji, nimekuwa wako Andrin Kilemi, mtangazaji kwa lugha ya ishara amekuwa ni Ann Wairimo. Usiende mbali, mwendo wa saa 1 kamili Paul Kirobi atakuwa anarejea na taarifa zaidi. Kwaheri kwa sasa.